Hi, welcome to the Mental Path Podcast. I'm Dr. Gretchen Guevara, and I'm so excited you're here for episode 2. I'm a psychiatrist and therapist, and I love blending science, psychology, and personal growth tools to keep my mental health in check. In this podcast, I'll break down insights and skills that I use myself to build resilience, and I want to share them with you to help you think and feel better. Last week, we talked about the 3 foundational areas of mental health. Number 1, your physiology, how your body is functioning. Number 2, your psychology, your thoughts, emotions, and behaviors. And number 3, your environment, the people, places, and things that influence your feelings. I enjoyed creating that first episode. Now, you might be wondering, how do psychiatrists fit into all of this? What is a psychiatrist and what do they really do? Why should you hear me out? I get it. There are a lot of misconceptions out there about what psychiatrists actually do. So today, we're breaking that down. I'm going to talk about how psychiatrists are trained to help and how we're different from other physicians and mental health professionals. My goal? Well, I want to share knowledge, challenge some stereotypes, and help you understand how psychiatric expertise fits the medical and psychology landscape. I also want to share a bit about my approach to care and mental health so you can feel confident about using the skills I share in this podcast. Let's get into it. Let's start with the basics. What is a psychiatrist? A psychiatrist is a medical doctor who specializes in mental health. That means we've been through medical school and completed years of specialized training in psychiatry, which is all about understanding your brain, body, and social factors working together to impact your mental health. Now, here's where some confusion comes in. As physicians, a lot of people think psychiatrists only focus on diagnosis and just prescribe medications. And yes, we determine diagnosis to guide recommendations. We can prescribe medications, but that's not all we do. Compared to other medical specialties, our training is grounded in the biopsychosocial model. That's biological, psychological, and social model. This means we don't just look at one part of you, like focusing on symptoms without understanding your story. We take a comprehensive approach looking at your biology, like brain and body health, your psychology, like your thoughts, emotions, and patterns, and your social factors, like relationships and environment, and all parts of your experience as early as your childhood that may be influencing your current knowledge, your current life situations, and ways you relate to the world. Let's say you're feeling stressed or down. If I'm supporting you as your mental health provider, it's my responsibility to understand as much of the context or story as much as possible. Identify the triggers, like what makes it better and worse, and as much relevant information as I can gather. The evaluation includes understanding how any part of your physical health is impacted or maybe even causing or contributing to your experience, from lifestyle habits to medical conditions and general physical health. Understanding your life story is also significant. This means having a sense of any external factors that affect you now, including any positive and negative experiences from your present and past life. This helps me understand your thoughts, emotions, your strengths, motivations, and fears. They help me identify appropriate strategies to help you cope and manage your concerns. A good psychiatrist should aim to understand these areas of your history. I don't believe in rushed evaluations. If you're seeing a provider, you shouldn't settle for that either. All individuals deserve the time, care, and attention when working with any healthcare professional. I know that the reality is that it's a flaw in medicine and healthcare. I really hope that more and more providers challenge and change that approach. Again, while diagnosis and medications can be helpful tools, they're not the whole picture. Prescribing medications is not where I start with most people. By sharing how I take care of others and of my own mental health as a psychiatrist, my goal is to help you address all of these areas holistically for yourself so you can feel balanced, capable, and in control. Now, let me share a little bit about my style because it's essential to know the how behind how I think and what I do. While the foundation knowledge is the same among all psychiatrists, like the biopsychosocial model, we all have different approach. In a nutshell, I help people find themselves by clarifying what they really want and how they can achieve it, such as moving from feeling down and anxious to feeling calm and grounded, or from fear and insecurity to courage and confidence. We can all do this by truly understanding ourselves and our patterns in thoughts, emotions, and behaviors. As I integrate all parts of one's history and life story, I start thinking about different strategies to improve one's emotional concerns. For me, it's not just about fixing problems. It's really about helping you build skills that make your life easier and more fulfilling. Yes, I look at the science and the medical side of things. I'm an avid student of personal development courses also, and they are a big part of my toolkit. I'm so excited and passionate about teaching people practical tools they can use every day, like reframing negative thoughts, setting boundaries, or managing stress before it becomes overwhelming. Let's look at an example. I've worked with many high achievers, people who feel like they have to do it all and end up burned out or stuck in cycles of self doubt. Instead of focusing on just one area like the stress levels, I help them look at all the problems from multiple angles. Suppose the concern is depression. As we identify the primary cause, I look at the details of their mental chatter, how they talk to themselves, how their past affects their current situation, and how they typically approach stress. I go into the details of their typical day from morning to evening to see what factors contribute to their current experience. I really gather as much information as I can about number one, the body. How are you sleeping, eating, moving? Or are there medical conditions or physical concerns that are impacting your mood? Number two, the mind. What thoughts are holding you back and what strengths can you lean into? And number three, environment. Like what relationships or responsibilities are draining your energy and how can we adjust those? I emphasize the basics of physiology, specifically the nervous system, like explaining the role of adrenaline, dopamine, and serotonin. I go into how the different parts of your history are tied to your current experience. I really guide you in clarifying your health goals and what they mean in the most important areas of your life. All this information ultimately informs the treatment plan and approach to help you move towards your goals or make the change you want in your health and life. Understanding all of this helps build self compassion. If you know how these all tie together, you don't have to be so hard on yourself. You feel more empowered because the areas and improvement methods become clearer. If medications are needed, I emphasize that medications are just one piece of the puzzle. It helps support the nervous system so that you're calm enough and your thoughts are clear enough to explore your experience, create a plan to get better, and learn the skills to help you overcome the situation. Outside of meds, I also guide you in advocating for addressing other medical concerns with your other providers because everything in your body is connected, like unresolved physical pain can cause or worsen emotional pain, and that affects your mood. Self-care and healthy lifestyle are at the top of the plan. Self-care includes taking care of the thoughts that design your emotions and experiences. Arming yourself with basic strategies to manage your thoughts is essential to feeling well. Simply providing a diagnosis and prescribing meds is incomplete. We need skills to improve any unwanted experience. For example, if depression is tied to burnout, do you need to build the courage to advocate for your needs at work? Or do you need skills to support your productivity? Or are you burnt out because of a belief that you must do it all or that your worth is tied to being busy and you need skills to challenge and change this false idea about yourself? My style is to focus on 3 layers of interventions. Number 1 includes strategies to manage in the moment situations like how to calm down in the moment of panic or how to handle tense conversations. Number 2 contains ways focused on prevention and supporting the body and mind to build resilience so you can handle the stress when it comes. And number 3 involves addressing deeper roots that are unresolved that are causing the current experience, like past or present trauma, or long-standing issues of low self-esteem, perfectionism, imposter syndrome, or many other causes. Sometimes the work is about building the clarity and courage to make significant life-changing decisions. Habits 1 and 2 support the deep work. All of these aren't just something I recommend in my office. It's how I live my life too. It's how I handle my own stress. These skills aren't about being in therapy or taking medication. They're life skills that everyone can use to feel better and live better. I'm really happy and grateful for where I am in my life. It's not flawless. No one's life is flawless. I've had challenges in growing up, school, career, even heartbreaks in parenting, relationships, and many others. I still have some sort of stress every day, some small, some big, some surprising. I'm sure that by training my brain to work and think the way it does, and having the constant practice talking about, teaching, and guiding others on how to build all kinds of skills, I'm habituated into looking at possibilities, resetting when needed, going after big goals, problem solving, and really taking action towards anything I try to change or achieve. I do this not in a magical thinking or unrealistic optimism kind of way, but in leveraging how the brain and body work and how capable we are in directing our thoughts and emotions to live the life we want in healthy ways that serve us and support our purpose and our life meaning. Wow, what a great conversation today. We covered a lot of ground, so let's quickly sum up what we talked about. First, we tackled one of the biggest misconceptions about psychiatrists, that we just diagnose and prescribe medications. And I hope I've shown you today that psychiatry is so much more than that. It's grounded in biopsychosocial model, which means we take a whole person approach, looking at your body, mind, and external factors, and how each area influences your mental health. I also shared my personal approach, which blends neuroscience, psychology, and practical strategies to help you not just manage stress or symptoms, but really thrive, live the life that you want. We talked about the importance of understanding the basics of your nervous system because feeling calm, confident, and grounded starts with knowing how your brain and body work together. And we highlighted an important truth. Mental health isn't just about quick fixes or putting out fires. It's really about building skills that make life easier, clearer, and more aligned with what matters to you most. Now, before we wrap up, I want to leave you with something simple but powerful to take away from today's episode. I want you to do a quick self-check-in, just like we talked about last week. Is there any part of your life that needs attention right now? How can your mental health support this? What skills do you need to build to strengthen your mental health? Once you check in, pick just one small action you can take to improve in one of those areas, whether that's addressing any medical needs that you've neglected for some time, or noticing and challenging a negative thought that's been on repeat. You could be adding this podcast to your calendar next week so you can continue to build skills. Remember, progress doesn't happen all at once. It happens one intentional step at a time. And you're already taking that first step by being here and showing up for yourself. Thank you so much for spending this time with me today. If you're finding these episodes helpful, I'd love if you could subscribe and share this podcast with someone who might need it too. Next week, we'll dive into how to look at your typical day to identify ways to improve your mental health. That episode is going to be all about actionable and practical strategies. I'm so excited to keep this journey going with you. So until next time, take care and don't forget to keep checking in with yourself. See you soon.